I don't think we always realize how lucky we are to be part of such a large medical center. I'm able to leave a classroom and walk over into one of the best medical centers.
So the Rush model is a bit different from many other academic medical centers in that our mission really is one of integration of all the different components of research, education, clinical care, and community service. Our education is not just in isolation in classroom, but is very much at the bedside and in the clinic and in the community.
The integrated model here at Rush is really unique. I don't have to pick just research, just education or teaching, and just practice. You really need all three components to have a holistic view of the nursing profession and how it impacts patient care.
The importance of nursing in this model is absolutely critical. Nurses here are both highly skilled and empowered, and make big differences in the day-to-day clinical decisions that are being made.
Even as a mindset, that's transformative. Just feeling empowered, feeling like you have the skills to go out and perform above and beyond where others are performing. I'm actually from a small town in Iowa, went to the University of Iowa. I studied global health and education. I moved to Chicago and started working with children with autism for Chicago Public Schools, and so I really just felt compelled to go into the nursing field. One very unique patient that I had just had abdominal surgery, was having adverse reactions to pain medication. She was in excruciating pain. She was intubated, she couldn't talk. And one thing that that patient taught me was it's not always what you can do medically. I think that was the first experience that I really had where my clinical skills didn't necessarily come in handy, but just being an actual nurse is what really mattered.
I pursued a BSN to PhD program, and it brought me to Rush due to their expertise in geriatrics. My research is focused on the care of older Latinos. I've had just superb mentors that have been able to really offer their expertise and wisdom.
I'm 28 years old. I'm originally from Los Angeles. I have a degree in psychology, and I came to Rush for a lot of reasons. I liked the teacher-practitioner model, being able to learn from faculty that are practicing day to day.
I oftentimes am able to integrate what I do in practice with what I teach in the classroom. And I really feel that I'm able to bring in a lot of experiences that I've had in the clinical setting and give an actual patient example.
I think the faculty embrace students as colleagues, and that's one of the things I love here the most at Rush. My favorite faculty member would have to be my faculty advisor. She's actually opened a lot of doors for me professionally. I do research with her. I'm interested in pursuing a doctoral degree, so it's fantastic to have that experience.
I am originally from New Orleans, and I attended college at Howard University, where I got my bachelor's in psychology. And I went into clinical research in oncology in Washington, D.C., and I actually transitioned to clinical research here at Rush in the Outpatient Cancer Center. I think initially I would like to go into critical care and work in critical care while I am pursuing my PhD. And from there I'd like to get into policy and hospice care. I think that the beautiful thing about Rush is that there are so many opportunities to meet faculty outside of the classroom and to find faculty that you have something in common with, a clinical interest or research interest. Every day I'm learning something new.
Here at Rush, our students get an opportunity to put those practical skills that they learn in the classroom setting to work within the community. Our students are so involved here locally and then also globally.
Rush does a great job of working with the community, making sure that we respect the diversity that's present. We're able to then move out into the community and really impact change.
They're learning today how to interact with other disciplines, how to work as a team, because it is the team that will care for the patient.
One thing I've learned is that I don't know everything, but Rush has prepared me to be resourceful, and I can figure those things out on my own now. I feel like I can go out and accomplish anything.